Experts are working on the front lines of the pandemic and say they are seeing a disturbing trend, an increase in COVID-19 patients, some who have not been diagnosed, waiting too long to seek medical treatment.
And those experts tell us treatments are most effective early in the disease. Bianca Murray found out what people can do to prevent missing that treatment window.
I'm told if you want to avoid ending up in there, step number one is to get vaccinated. Regardless of your vaccination status, however, health experts urge early testing so you can know to seek treatment.
I hear so many people say, well, I didn't have a fever, so I didn't get tested. You may not have a fever. You may not have cough, but if you're not feeling well, if you're congested, please don't just assume that it's allergies.
After getting a COVID test, Ballard Health's Jamie Swift says patients should seek treatment before the disease takes over.
What people need to realize, monoclonal antibodies need to be given as early as possible in the course of illness. If you come into the hospital several days later and you have an oxygen demand, you're actually no longer eligible for monoclonal antibodies.
EMS workers say they've seen an increase in patients waiting for their symptoms to become overwhelming before seeking care.
In September, we saw about maybe 8 cases a day. It was overwhelming. Through October, we had a little sigh of relief. It was maybe 1 case a week. It was great. I thought it was going to be over, hopefully. And then it started over again. And we're back to 8 cases a day. It's bad out there.
Garby says in the greater Kingsport area, Sullivan County EMS may transport up to 18 patients in a 24-hour shift. He says recently half of those have been COVID patients, and he says the calls keep coming.
We're getting to the point now where we are probably going to have to just start bringing in a patient and then dropping them in a bed or wherever we need to and then leaving, because our system is that taxed.
As the virus spreads through the community, healthcare providers say they hope vaccinations go up so the system won't become overtaxed as we face yet another winter surge. Swift says the Ballard Health Emergency Operations Team is evaluating the surge to ensure that hospitals are ready for the onslaught of cases, but they hope it won't be necessary. In Johnson City, Bianca Murray, News Channel 11.
And Ballard Health says it has not received an allocation of the new Merck COVID-19 treatment pill from the state just yet. But as soon as they do, a team will develop a treatment protocol for patients who qualify.